Hello guys, this is Dr. Ajinkya here. So in today's lecture, I'll be discussing about the cavernous sinus in detail. So previous lecture, I took on the anatomy of the dural venous sinuses. So you can go and check it on my channel list, which will be right below this one. So today will be all about cavernous sinus, and this video I'll be talking about the anatomy in detail. Also be talking about the relationships of the surrounding venous sinuses to the cavernous sinus, and what exactly is the clinical significance and the clinical anatomy of the cavernous sinus. So this video is really important for the first year MBBS students, also those who are in third minor batch, also those who are ENT residents, skull-based surgeons, and the neurosurgeons who operate on cavernous sinus lesions and tumors endoscopically, endonasally. So before starting this video, I would like to mention point: those who are skull-based surgeons or those who want to become a skull-based surgeons, if they want to read some skull-based surgery books, I have a lot of links posted in my description comment panel, so you can go and click on any of the links given below, so you can buy a skull-based surgery book, which I would definitely personally recommend for your concepts. So let's begin, guys. So the first point: whenever a question is asked in case of theory exams to any one of the guys in MBBS or ENT residency exams, so the first thing, if a short note is asked about the cavernous sinus, you should mention the introduction, in which you should define the cavernous sinus. Now, any sinus is defined as the collection or pooling of venous bloods, or a collection or a network of venous channels that is enclosed or trapped within the two layers of the dura mater. Now, we all know that there are three meningeal layers: dura, arachnoid, and pia. So the dura has further got two levels of layers, which is the towards the bony side is called as the periosteal layer, or you can say the endosteal layer, depending on the which side which you're examining from. And the second one will be towards the meningeal side, that's the arachnoid, is called as the meningeal layer of dura. So between these two layers is enclosed the sinus in general. So the cavernous sinus is defined as this definition, plus situated on either side of the sphenoid body, that's the sphenoid sinus, in the middle cranial fossa. Remember guys, the cavernous sinus is in the middle cranial fossa and not in the anterior cranial fossa. Okay, that is a very important point you have to remember. So that's the introduction definition. Now it has a huge clinical anatomy and significance. So the second point is the anatomy. Now in the anatomy, what you need to define is the clinical relationships of the cavernous sinus to the surrounding structures. Second, the contents of the cavernous sinus itself. Okay, and third, which is the clinical significance, in which you mention what can happen if there is an infection or thrombosis, what is the complication of the cavernous sinus, and what all symptoms and signs you have to mention that, and the investigations and the treatment. So also, apart from all these points in the anatomy, the first point was the structures surrounding the cavernous sinus, second was structures within the sinus, and third one is the draining channels. So the channels or the tributaries which drain into the cavernous sinus, and the second point will be the tributaries or channels which drain from the cavernous sinus. So if you mention all these points in your exam, I think you can get almost full marks in your theory, or even in the viva question. So the first point is the structures surrounding the cavernous sinus would be the first. The external connections, the external relations will be divided into superior, inferior. So now this is the superior, as you can see on the screen right here. This becomes the superior, this is inferior, this becomes medial, as this is the right side, this becomes medial, this becomes lateral. So superior, inferior, medial, lateral, inferior, lateral, then anterior and posterior if viewed from the sagittal action. So this is a pituitary gland, that's the sphenoid sinus. Now I'll be also showing you the cadaver photos, the cadaver dissection, to make your anatomy totally perfect about the cavernous sinus. So I'll be dealing with the entire 3D anatomy of the cavernous sinus in this today's video. So the first one is the superior. So superiorly will come definitely the optic nerve, optic tract, optic chiasm, the olfactory tract, Okay, that will become the superior relationship. Then inferiorly will be the area of the union of the greater wing of sphenoid with the body of sphenoid. Okay, that's one thing. Also there will be foramen lacerum inferiorly. So superior is clear, inferior is clear. The inferior laterally, you can see over here, that's the foramen ovale, that's the mandibular nerve. As we all know, foramen ovale consists of mandibular nerve, MALE, one of it is mandibular nerve, and the lateral wall, the medial wall. Now medially, you can see it is concerned with the sphenoid sinus, it is concerned with the pituitary gland. So that's the medial relationship. Then the lateral relationship will be here. As you can see, it will be presence of the temporal lobe with the uncus. Okay, so these are the relationships. Then becomes the anterior and the posterior. Now anterior to the cavernous sinus is the orbital apex and the superior orbital fissure. Now remember that orbital apex is an entire region, and superior orbital fissure is just a part of the orbital apex through which the contents of the cavernous sinus enter into the orbital apex. So you have to remember, guys, that the orbital apex is an entire region, and there's an opening which you can see which is called as a superior orbital fissure, through which the contents of the cavernous sinus, for example this third, this fourth, this V1 and V2, they enter into the orbital apex through that superior orbital fissure. Okay, so that becomes the anterior. So in simple words, cavernous sinus anteriorly continues as the orbital apex, remember that, also called as the superior orbital fissure. Posteriorly there will be nothing but the petrous apex, that is the petrous apex of the temporal bone. So this is a complete external relationship of the cavernous sinus. The second main heading will be under the anatomy, will be the internal contents of the cavernous sinus. Now this is actually the most important part of your question of the cavernous sinus, that is internal contents of the cavernous sinus. So as you can see over here on the lateral wall, you can see from above downwards, you can see the third nerve, that's the oculomotor nerve. You can see the trochlear, the fourth. Then a little bit down you go, you can see the ophthalmic nerve, that's the V1, a part of the trigeminal nerve. Then that's the V2, that's the maxillary nerve. That's it. So these are the only contents you can see on the lateral wall of the cavernous sinus from above downwards. And if you go medially and towards inferiorly, you can see the internal carotid artery, and you can see the abducens nerve. Now the most common question asked in the viva is which nerve passes through the content or the center of the cavernous sinus. So your answer should always be the abducens nerve. The second common question asked is that which structure is medial to or lateral to which one. So you always have to remember that the artery is always medial, the nerve is always lateral. Always remember that. Okay, so the artery will be always medial and the nerve will be inferior lateral to the nerve. So these are the two contents of the lateral and the medial wall. Now there's one more very important question asked by the examiner, which I have seen personally, is that they ask you what is the structure that differentiates, or you can say separates the two lateral and the medial wall contents. Are they in connection? Are they separated by something, or what? So the question should be yes, they are separated by a structure called as the endothelium. You can see this whitish gray structure all over here, that's the endothelium, and the green structure which you can see over here is the cavernous sinus, which is the blood venous collection. So the blood in the medial wall and the lateral wall is separated by the endothelium. So this is a very important point, guys, remember that. So these are the three questions which they can normally ask you in case of the cavernous sinus internal contents. So we also know that the floor of the cavernous sinus, which is formed by the maxillary nerve. So the inferior boundary is the V2. So below V2 we enter into the proper middle cranial fossa contents. So V2 becomes the inferior boundary of the cavernous sinus, and superiorly the cavernous sinus is having a boundary as the optic nerve and the internal carotid artery junction. Okay, so this is the internal contents of the cavernous sinus. Now moving on to further ahead, if you see these images around here, these images show you the third main structure in the anatomy was its connections, the incoming channels and the outgoing channels from the cavernous sinus. So as you can see over here, this is a rough anatomy of the entire dural venous sinuses. So you can see over here, this is the cavernous sinus of the left, that's of the right. So always remember that the incoming channels should be first. So the incoming channels should be first. I'll just show you the incoming channels first. Okay. So as you remember, the superior ophthalmic vein. Okay, you can see this is the ophthalmic vein over here. Okay, that's the ophthalmic vein. So the superior ophthalmic vein, then the inferior ophthalmic vein, and the central retinal vein, they drain directly into the cavernous sinus. Okay, so if you further refer to this diagram over here, yes, so if you refer to this diagram, if in the exam you can draw this diagram, a rough diagram. So onto this side of the screen over here, where my cursor is, are all the incoming channels to the cavernous sinus, and onto this side is mostly all the outgoing channels of the cavernous sinus. So if you ask, the main thing that there are main three structures who give the incoming channels, or we can say drain into the cavernous sinus, is the orbit, the brain, and the meningeal layers. Okay, so three broad headings. Remember that you can make a tabular form of all these points, make notes of it, and you can write them in the exams. So first in the orbit, you can see the superior ophthalmic vein, then you can see the inferior ophthalmic vein. So superior ophthalmic vein directly drains into the cavernous sinus, as you can see over here. The inferior drains directly into the cavernous sinus. Then you have the third one is a CVR, or you can say CRV, the central retinal vein. Okay, you can see this is a central retinal vein. In most cases, it drains into the superior ophthalmic vein and then in the cavernous sinus. But in sometimes it may directly drain into the cavernous sinus. So these are the orbital incoming channels. Then comes the brain. Now in the brain, you can see over here, that's the superficial middle cerebral vein. Okay, that's the superficial middle cerebral vein and the inferior cerebral veins. These veins drain into the cavernous sinus. And the third one is the meningeal area. So in the meningeal area, you can have the middle meningeal vein, which pass through the foramen ovale to drain into the cavernous sinus. Okay, so these are the three areas of incoming channels to the cavernous sinus. Now the most important thing is the outgoing channels. Now the outgoing channels, for that you have to refer to this diagram over here. Okay, so as you can see, this is a cavernous sinus right there, and you can see this is an anterior aspect, that's the posterior aspect. So posterior superior, posterior inferior. Okay, so if you have referred to my previous video about the anatomy of the dural venous sinuses, if you haven't, please go check it out, read that video first and then watch this video. Okay, so this is the superior petrosal sinus, and this is the inferior petrosal sinus. The superior petrosal sinus drains the cavernous sinus from posterior superiorly into the transverse sinus. Now that's the transverse sinus. The inferior petrosal sinus drains the cavernous sinus into directly the IGV or the jugular bulb. Okay, so these are the two outgoing channels for the cavernous sinus over here. Okay, so further it may also drain out through the spinoparietal sinus in case of the meningeal layers. So there's one more, is the spinoparietal sinus, which I can show you right here, that drains as a outgoing channel. Spinoparietal sinus. Okay, yeah, there you go. So you can see this is a spinoparietal sinus and that's the cavernous sinus. So this is an incoming channel actually, and as you can see over here, this is the superior petrosal sinus, which is an outgoing channel. This is an inferior petrosal sinus, which is yet another outgoing channel. So these are the various areas where the cavernous sinus drains externally. So you all have to remember these basic points. If you read, it is very easy to understand. So make notes of this, read it few times, and then you'll be able to understand the anatomy very, very clearly. So this was a basic clinical anatomy of the entire cavernous sinus clinically. Now I'll show you certain cadaveric photos for you guys to understand the basic very easily. This diagram just represents the cavernous part of the internal carotid artery. In my previous lectures, I have taught this internal carotid artery as well, so you can go and refer that to video as well. So yeah, this is the image of a cadaver, endoscopic. So what you see is a pituitary gland over here. Okay, you see a pituitary gland over here. Now you always have to remember a basic concept that right side and the left side cavernous sinus is interconnected to each other via the superior intercavernous sinus, as you can see over here, and the inferior intercavernous sinus, as you can see over here anteriorly, as well as behind the pituitary gland and through the basilar venous plexus. So this is also the most important point, that yet another Viva question, that how is the right and the left cavernous sinus connected? So you should say that they have an intercavernous sinus connection through these sinuses above and below and behind through the basilar plexus. So that's the pituitary gland. So above the pituitary, below the pituitary, in the two layers of the dura which covers the pituitary, you can see the intercavernous sinus. That's the carotid artery you can see. Now this is an endoscopic photo of the inside of the sphenoid sinus. This is the midline. This is the right sphenoid. That's the left sphenoid. So if we remove the entire bone on the lateral wall of sphenoid, where the sphenoid cavernous sinus lies, so we can expose actually the carotid artery, as you can see. That's the Viridian nerve, that's the pterygopalatine ganglion, that's the foramen rotundum, that's the V2 nerve, that's the peri-orbital. So as you can see over here, this is a case of right side cavernous sinus. This is a right side. So whatever you see in blue over here, that is all nothing but the cavernous sinus. Okay, so this is a paraclival carotid. So the carotid ascends upwards. Now remember, this is the right side of cavernous sinus. So this is a paraclival carotid. So if you dissect and remove all the structures, you can see this is the trigeminal ganglion over here, also called as the Gazarian ganglion, from which you can see the V1, the V2 and the V3 below. So we as students normally refer to this image, right? That is, this is the third nerve, then the fourth nerve, then the V1, the V2. But we never observe the nerves in this way. So we can see the V2 over here, the ganglion from which the V1, V2 and the V3 arise. Okay, so this is the rough estimate of the cavernous sinus on the right side. If you go further, remove the contents, you can see this is the carotid artery. This is the right side cavernous. You can see this is the optic nerve. Okay, optic nerve was a superior relationship. Now this is the third cranial nerve, as you can see over here, guys. Now let me just show you this rough anatomy. Third, fourth, V1, V2, ICA and the abducens sixth nerve. This was the pituitary. This was the bone which we have removed now. Exactly, so we can view all these structures. So going back again to that cadaveric photograph, we have, as you can see, this was the common carotid artery, that is the internal carotid artery, the cavernous carotid. Just we can see here the third nerve, the fourth nerve, the V1, the sixth nerve and the V2. Okay, so at the level of the V2, as you can see, the cavernous sinus ends, and there you can see the V3 which will come out from the foramen ovale. This is the V2 which is coming out of the foramen rotundum, as you can see over here. So this is the rough anatomy of the cavernous sinus to an endoscopic skull-based surgeon's point of view. So those who are in the MBBS will have a new knowledge after watching this video. So this is the third, the fourth, the V1 and the V2. So these four nerves are on the lateral aspect. Now after dissection, you can see the sixth nerve is actually kind of medial to all these four nerves. And here you can see this is the trigeminal ganglion. The bulge you can see over here, that's the trigeminal ganglion, also called as the Gazarian's ganglion. Okay, so V1, V2, V3, 3, 4, and this is the internal carotid artery. So this is how the cavernous sinus exactly is, the anatomy of it. Now this is much more, this is a zoomed in version. You can see this is all blue. That's the cavernous sinus. That's the pituitary gland. That's the internal carotid artery, like a tortuous course. And you can see that's the trigeminal ganglion. That's the V2. That's the foramen rotundum and all. So if you further dissect inside, you can see all the nerves passing through. And this is what you see over here. This is nothing but the sympathetic plexus of nerves around the ICA. This is the nervous system. Okay, so that was all about the clinical anatomy of the cavernous sinus in pure detail. Now that half of the question is already done. Now moving on further is a very important point, that if you're mentioning about the cavernous sinus, you have to mention about the branches of the internal carotid artery in the cavernous sinus. It's the blood supply of it. So you have two major trunks. Now this is the lateral view of the internal carotid artery in different segments. So the C4 segment, which you can see over here, is the cavernous part of the internal carotid artery, where they have two main trunks called as the meningohypophyseal trunk and the inferior lateral trunk. Now the meningohypophyseal trunk further divides into three branches, which is the inferior hypophyseal artery, dorsal meningeal artery, tentorial artery. And the inferior lateral trunk divides into four branches, which is the one which is also called as the proximal superior, the branch to the superior orbital fissure, the branch to the foramen rotundum, and the foramen oval. So if I try to zoom in this for you guys, now you can actually take a screenshot of this and you can revise about this later. So this is about the branches of the ICA in the cavernous sinus. So this is all about the cavernous sinus in detail. So if you asked a question in the exams, write all what I've mentioned about the cavernous sinus in the exam, draw these diagrams. Now this is a superior view of the cavernous sinus if viewed from above. As I said, this is a basilar plexus of veins behind the pituitary gland. Okay, and these are all the incoming and the outgoing channels, and these are the other relationships of the dural venous sinuses. So this is a rough anatomy of the entire cavernous sinus in detail. Okay, so moving on further, how exactly a cavernous sinus looks like on an MRI is that you can see this is a rough pictorial diagram. This is a pituitary gland, as I showed you in the cadaver photos. That's the pituitary stalk, which ends up in the hypothalamus. These are the two red holes of the internal carotid artery itself. So it's a cut section because the carotid artery takes a turn anterior and posterior. So you can see on the cut section two holes over here. And whatever you see in green is the boundaries of the cavernous sinus, and whatever you see in blue is the blood in the cavernous sinus. And you can see the third, the fourth, the V1 and the V2, then the abducent nerve. You can exactly correlate that. This is a sphenoid sinus, and you can exactly correlate that on the MRI. That's the pituitary gland over here in the center. So the pituitary gland lies in the center of the cavernous sinus in the midline. Okay, so that's the pituitary stalk right there. And you can see the two holes of the internal carotid artery. That's also the internal carotid artery over here, the black flow void. As you can see over here, if I zoom this image for you guys, you can see the small grayish shadows. These are the third. This is the fourth over here. That's the third. That's the fourth. That's the V1. That's the V2. So this entire white structure is the cavernous sinus. Now, why is it appearing as white? Because this is a post-contrast MRI, and because there's blood, a lot of blood in the venous channels, so they take up the contrast and they flare up. So as you can see over here, this is the third nerve. That's the fourth. That's the third nerve. This is the fourth nerve over here. That's the V1, and that's the V2 below. Okay, and these are the two holes of the internal carotid artery. That's the pituitary gland, and that's the optic chiasm over here. Okay, so this is how you can see the cavernous sinus on an MRI. So if you want to see a live motion MRI and how the MRI shows you the cavernous sinus, here you can see. Now this is a T2 weighted image of the MRI. This is a sphenoid sinus. So if you go behind the sphenoid sinus on the lateral aspect, here you can start seeing the cavernous sinus right there. And as I mentioned, the lateral relationship is the temporal lobe with the uncus. What is this? This is nothing but the temporal lobe of the brain. So that's the cavernous sinus over here. If you keep on going behind, you can see the cavernous sinus, and you can see the two holes right there. That's the optic nerve, that's the optic chiasm. You can see the two holes, that's the internal carotid artery. If you keep going behind, you can see the two holes. You can actually see the pituitary gland over here. That's the cavernous sinus over here. That's the cavernous sinus. That's the cavernous sinus. And if you look very closely, guys, you can see the third nerve. You can see the fourth nerve. You can see the V1 and you can see the V2 well below over here. So these are nothing but the cavernous sinus structures. So this is a pituitary gland, and then this is the optic chiasm over here. So always remember that the pituitary gland is below the optic chiasm. So this is the optic chiasm, that's the lateral ventricle, that's the pituitary that's the third ventricle, that's third ventricle, that's the optic chiasm, that's the pituitary gland. Okay, so I hope the anatomy of the cavernous sinus is very well oriented for you guys now. And if you like the video, leave a comment, or if you have any doubts regarding your studies in future, whatever you want to learn from me, what you don't know, you can just post your comment. I'll be always free to teach you guys whatever you have a doubt in. So do subscribe and do like my videos. Thank you guys.